This is Josephine Herndon with the Week 3 Axial Skeleton Lab video assignment. We are to point out the following structures and describe certain items or parts as needed. First, we have the cranial bone, so I'm going to remove this to show the bones. This is the frontal, the parietals, and then in the rear we have the occipital bone, and then there's a little portion here which is the external occipital protuberance, which helps to support the weight of the head, and then we have the temporal. In terms of the temporal, let's get this up here. The temporal bone, we have the temporal mandibular joint, the mastoid process, which is here, the styloid process, which is difficult to see, but it's a little protuberance here, and then the external acoustic meatus, which is right here, and then the squamous part, which is up here. And then we have the petrous part of the temporal bone, which houses the middle and inner ear cavities, the internal acoustic meatus, the cranial nerves 7 and 8 pass through this opening, and then we have the sphenoid, which actually is difficult to see, but it's on the inside here, and it's this portion right in here. And we have the superior orbital fissure, which is here, the lesser wing, which is out on this portion, and then the greater wing, which is this larger portion inside here, and then the optic canal, and the cranial nerves 2, which are the optic nerves, pass through these openings, and then the sella turcica, which is here, and that houses the pituitary gland. And then we have the ethmoid, which is this portion right here, which includes the crista galli, which is pointing up right here. This is an attachment site for meninges that cover the brain. And we also have the cribriform plates, which are on either side of the crista galli. The philo-olfactoria, or the olfactory nerves, pass through those holes. And now we have the sutures. This is the coronal suture, which is formed by the frontal and parietal, and then the sagittal, which is formed by the two parietal bones, and the lambdoid, which is formed by the occipital and parietals, and then the squamous, which is formed by the parietal and temporal. We have the facial bones, the maxilla, and alveolar process, the zygomatic, which is formed by the zygomatic and temporal processes. The ethmoid, which is inside the orbits. The vomer, which is just inside as well. This forms the bony nasal septum is formed by the vomer and ethmoid. The inferior nasal concha, which is actually inside here. And then we have the mandible, which includes the body, the angle, the ramus, the mandibular condyle, the mandibular notch, and the coronoid process. And then we have the vertebral column, which includes the cervical, the thoracic, the lumbar, and the sacral. The thoracic and the sacral are primary. We have those from birth. And then the secondary are the lumbar and the cervical. There are 7 cervical vertebrae. The atlas articulates with the occipital condyles, and this forms an atlanto-occipital pivot joint, which allows us to rock our heads back and forth. What is unique about the transverse processes of all cervical vertebrae compared to those of thoracic and lumbar vertebrae? It allows for passage of the vertebral artery and vein. And we have the thoracic vertebrae. There are 12. We have the we have the spinous process, and then the transverse processes, the intravertebral foramen, which are difficult to see, but it's a little section here, the body or centrum, which are the part here, and the position of the intravertebral discs. So we have the discs here. And then there are 5 lumbar vertebrae, which include the sacrum, the lumbar, which include the sacrum and the coccyx, sacrum, coccyx. And then we have the sternum, which includes the manubrium, which is this portion here, the body, the xiphoid process, and the jugular notch. And then we have the ribs, the true ribs, and then the false ribs, the vertebrochondral ribs, and then the head would be the attachment portion, The neck would be just slightly next to it. And then the tubercle would be this rounded area. The true ribs articulate with the sternum via the costal cartilage.